Okay, great. Well, hello, everybody. This is the Library Lunch and Learn webinar. So typically, we have every third Wednesday of the month, we'll do a lunch and learn. And then in the summer, we take a little break on that. So hopefully, this will be a great series that we can build upon and continue for y'all to just learn about, you know, what different organizations and companies can do and just different education and tools for y'all to learn about. So I did invite two wonderful audiologists to join us today. Please bear with me. I forgot to introduce myself. My name is Brenda Boaz Pond. And I'm the one that's hosting this lunch and learn this afternoon on Zoom. So I work for the Library Services for the Deaf and Hard of Hearing. We do have an interpreter here with us today. So if anyone uses ASL, please go ahead and utilize the interpreter. She can voice on your behalf. If you need to voice something, go ahead and just raise your hand, and the interpreter will go ahead and facilitate that. You are also able to use the chat box if you have any questions. And I'll go ahead and monitor the chat to see if there's any questions, and we'll go ahead and answer those at the end. If something is not clear, please don't be afraid to interrupt and just raise your hand and ask. And also, and if there's something that would be easier for you to communicate, just let us know. One of the audiologists that we have here today is going to be talking specifically about hearing aids, the benefits of hearing aids, and also we'll talk about just different components and parts of the hearing aid. And then she will also give out information related to that. And if there's any questions, feel free to utilize the interpreter or the chat box, and I'll facilitate those. So I think let's go ahead and start with Dr. Laura Gifford. And when Dr. Laura Gifford is completed with her presentation, let's go ahead to our next audiologist, Dr. Randy Yantz. Okay, so I just briefly, both of you guys have been involved in the hearing world here in Nashville. Is that correct?
Correct.
Yes.
Awesome. Awesome. So if you guys wanted to even just introduce yourself briefly, let's go ahead and start there. And then I'll go ahead and go cameras off, and then I'll spotlight the one person presenting. And then once the first presentation is done, then I'll go ahead and spotlight Randy second. Okay, so I'm going to go ahead and start with Dr. Laura Gifford. So Randy, if you wouldn't mind going cameras off, and then we'll switch to you in a moment. Awesome.
Hello. So I'm Dr. Laura Gifford. I work in Goodlettsville at Audiology and Hearing Health. I've been an audiologist since 1996, and I grew up in Middle Tennessee, so I'm pretty local. I went to MTSU and then to Vanderbilt for my audiology degree, and I've been in Nashville since I finished school. I've worked in different audiology clinics in Middle Tennessee, as well as for hearing aid manufacturers, a couple of different ones. So I know a fair amount about hearing aids. I've been at this clinic for about a year and a half. The clinic itself, though, has been here for 30 years and is owned by another local audiologist. And we're independent. Um, and we do treatment plans, including hearing aids and tinnitus work and hearing protection. We work with musicians and first responders and all kinds of folks. We do not work with children here. I have worked with children in the past, but it's super fun. I'm kind of a hearing nerd. I like to help people get what they want out of their lives and out of their communications. If anybody has any questions, feel free to ask.
Awesome. Okay, just give me one moment. All right, so the first question, how many brands of hearing aids and which hearing aids are beneficial for those who have mild to severe or profound hearing loss?
So I'm going to start sharing my slides, but it's kind of a trick question. Oh, I think I'm going to start sharing my slides. The reason I say it's a trick question is because there's no one best hearing aid. Okay, can you guys see my slides now?
Yes, the interpreter is able to see it.
Okay. So there's no one best hearing aid. Um, there are many different manufacturers that make prescription hearing aids. There are also several manufacturers that make over-the-counter hearing aids. What is important is to get the right hearing aid for you. None of these brands that I have listed here is the best brand. I have a favorite brand. Dr. Yance has a favorite brand. Every manufacturer, every audiologist has different experiences with different companies. But the important thing is to get the hearing aid that's right for the person based on features and technology. So, for example, the over-the-counter devices that came out were designed for mild hearing loss, but they're sort of generic. They're not so personalizable. If you have a severe hearing loss, there are a couple of companies that make better power devices, but it's not just one company and it's not just one device. Phonak or Starkey are long since affiliated with great power devices, but also now Signia works with them. So the important part is to create a relationship with a manufacturer. So not with a manufacturer, with a provider that'll set you up with the right manufacturer, because then it's specific to you. So the important thing is not which hearing aid you get or which company you go with, but who you're working with as your provider. Like here, for example, we work with all of the prescriptive devices, all of these companies, we work with all of them. We choose different companies for different types of patients. We don't necessarily work with over-the-counter devices here, but if someone has one, we can help them maintain it. Um, we don't do cochlear implants here. Dr. Yance has cochlear implants in her offices. So each person has to find the right provider for them. And hearing aids vary. So there were all those different companies, but within each one of those manufacturers, there are all these different technology features. There's different styles, different amounts of volume that the hearing aid can put out, different abilities to connect with your cell phone or your computer for work. Some have batteries still. Most of them are rechargeable now. So it's that's why I say it's a trick question because there are a lot of things to consider, including your hearing loss. So as you can see on this graph, there are many, many different ways to look at hearing loss. You could have normal hearing and still have trouble hearing in background noise. Is that a hearing loss? Maybe not, maybe, but maybe it's something that you need help with or a treatment plan for. Um, Do you have a profound hearing loss? Is it mild? And it could be different at different pitches. Lots of hearing losses that are a result of noise or just aging or genetic hearing loss. Sometimes the hearing loss for the low pitches is good, and then the hearing loss for the high pitches is bad. So everyone's different and unique in their hearing loss and in their needs. So, what do people get from hearing aids? Um, it kind of depends on what you're missing. If it's important to you to hear your grandchildren, if it's important to you to hear in a meeting at work, if it's important to you to hear the birds outside or the ocean, everybody's priorities are different and everybody's needs are different. And hearing aids can give you all of that back depending on your hearing loss and the technology that you choose. Um, they're accessories. You can connect directly to your television sometimes with a bridge, or even some of the new televisions connect directly to hearing aids. You can connect to your phone. There are external microphones that somebody can wear if you're having trouble hearing a speaker at a university or in a church. You can have them wear a microphone and it sends their voice directly into your hearing aids. So there are lots of different things to consider, and that's what makes it so fun. So, Brenda, if you want to come on and ask the questions, that's fine, or I can just keep going through the slides. I think I lined them up for you. Sorry, there's a fly in here.
Yeah, I think let's go ahead and move forward with the presentation.
Okay.
And then um, I do have a question really quick for hearing aids. So which FM system would be best to use?
So that's a great question. I love FM systems. Um, but FM systems are actually older technology now. The system that is the most popular for education and presentations and things like that is called Roger, and that's made by a company called Sonova, and that can be used with Phonak hearing aids or Unitron hearing aids. What we're finding now is the personal, uh, there's still situations where that Roger system is best for large groups, for classrooms, for um, large business meetings. Something like the Roger system is ideal. It doesn't work on the same technology that FM systems worked on, but it's the new equivalent. However, anyone can get a partner microphone from any hearing aid manufacturer. They all work with them. So just for personal use, anyone can have a microphone that they give to someone or they put on a table to understand people at dinner better. That's very common and super easy to do now. There are even some hearing aids that work with your iPhone in such a way that you can use your iPhone as a microphone, which is super cool. I think that Oticon is another great hearing aid manufacturer. I think that they also have some technology that's sort of the new version of an FM system. But if you went with other manufacturers, it would be a more personal device. Now, several years from now, 7 to 10, 5 years on the short end, 10 years on the far end, Auracast is a new technology that's common, that's going to be common in all technologies across the board. Hearing aids will be at some point Auracast compatible. A couple of hearing aid companies are already compatible with Auracast. There's just not enough Auracast out in the world yet to use much. Auracast will replace what we call loop systems, if you're familiar with a loop system. So in a theater or a large venue of some sort, a bank, um, those are the types of places historically that have been looped. Loop systems have been set up in those venues. Now, in a few years, Auracast will do that and it'll just be able to talk directly to the hearing aids. So whatever happens in the sound system for the church or the school or the theater, instead of having to listen to it through speakers, the whole sound system will come directly into the hearing aids via Auracast. So that's going to be super cool when it's ready.
Awesome. Perfect. Well, we do just have, if you wouldn't mind just sharing a little bit, 1 minute about insurance covering hearing aids, the cost of that, and if there is programs for low-income individuals.
Okay.
What is the
Uh,
possibility and availability of something being covered by insurance and also in regards of an evaluation as well?
okay. Most insurances cover an evaluation with a copay of some sort, as long as you've met your deductible. Most insurances will cover one hearing test a year. As far as hearing aid coverage for insurance, that gets a little more complicated. There are very few insurance plans that actually cover hearing aids. There are a couple of plans, Blue Cross Blue Shield Federal, and I think there's Seventh-day Adventist insurance coverage that will actually allow you to go wherever you want to go, get whatever devices you need, and then they just reimburse a specific amount of money. The more common thing that insurance companies are doing is pairing up with third-party networks. The third-party networks are usually owned by a hearing aid manufacturer, not always, but almost always. And you have to call the 800 number for that third-party group, and then they refer you to a clinician somewhere. And you have a limited, some are limited, some are less limited, but there are certain hearing aids that you can get through that program at a discounted price. And sometimes it's a really big discount. Um, Sometimes it's not. It just depends on the plan. So the consumer has to be very aware of what the benefit is and what they're able to get. And they have to be, again, I went to this at the beginning, they have to be very, very careful about getting the right provider. Um, so if they refer you to a provider that you're not comfortable with, you need to call them and have them refer you to a different provider. You can also go, like our office does not work with these programs because of the limitations. We don't want to be limited in what we can offer our patients. So you wouldn't get referred to us, you'd get referred to somebody else, which is Dr. Yance is not far from us and her offices handle those, and that's great. You just want to be very sure where you're going and who you're getting and that you're getting the devices that you need. Um, if you don't have insurance coverage and it's cost prohibitive to get hearing aids, Dr. Yance and I both work with a great organization called Hear Nashville. And if I have a patient come in who doesn't have coverage and wants to stay with me as a patient and they can't afford to get hearing aids from us, then I refer them to Hear Nashville. It's a super easy application process. You send an email or make a phone call. They ask you some pre-qualification questions. Let me see here. I actually have some slides at the end about that. Oh, and there's another option too. If you can afford to purchase devices and you don't have coverage, but you can't afford to pay for it all at once, there are zero interest financing options through this Care Credit Company. But back to here, Nashville, um, it's financially based. So you have to give them information about your income and your assets and the size of your family. And if you qualify, then the application fee is $300, and here Nashville covers everything else. And so you get a set of really nice devices with a reliable clinician and a year's worth of maintenance, which is important because hearing aids are not like eyeglasses. If I get the right prescription put in these glasses and it doesn't change for 10 years, I can wear the same glasses. I've probably had these glasses for 10 years. Hearing aids are microcomputers and they're on your person. So in the ear and on the skin is a kind of hostile environment for electronics. So it's very, very important that you get wherever you get your hearing aids, you have to make sure you go back and have them maintained we have a whole, at our office, we have a whole process for this, but once you get hearing aids, you're not just getting them and you're done. It's an ongoing relationship with your audiologist.
Awesome. Great. Thank you so much for your time. So
Thank
I
you.
guess just for time's sake, let's go over to Dr. Randy Yance.
All right, let me start sharing my screen here.
Oh, and 1 second, Dr. Yance, let me go ahead and pin you.
Okay.
All right, we are ready for you. If you wanted to go ahead and give yourself an introduction and then head in.
Yeah, so my name is Randy Yance. I am the owner of Aspire Audiology. We have 8 locations throughout Middle Tennessee. I'm currently sitting at the Madison, Tennessee location, but we have a location in Spring Hill, Madison, Green Hills, Lebanon, Hermitage, Murfreesboro, Columbia, and at the St. Thomas West location. So pretty much spread out all throughout middle Nashville, Tennessee area. And like Dr. Gifford was saying, we do work with hearing aids, but we also work with cochlear implants, which is what I'm actually going to talk about today. All right. Can you guys see my screen?
Yes.
Okay, good. All right. Like I said, I work for an own Aspire Audiology, and I'm going to just kind of give a little brief introduction and explain kind of the difference first. A question we get a lot is what's the difference between hearing aids and cochlear implants? So basically, cochlear hearing aids are amplifying the sound. So they're little computer chips in a little case that you put on top of your ear, set to your prescription. They're depending on the inner hair cells in your cochlea to send sounds to the brain. So it's external device only. So most of you have seen something, you put on top of your ear, something you put in your ear that you take out, at night to change the battery or charge. The difference between that and a cochlear implant is the cochlear implant is actually bypassing your damaged hair cells and directly stimulating the auditory nerve with an electrical signal. That electrical signal helps to give you that clarity that you usually start missing when you have hearing loss. So the difference too is you actually have a surgically implanted device and something you wear outside of your ear. So it's not just the one part you put on top of your ear, you have something surgically implanted and then something sitting on the outside. So a lot of people come to us and they say, when should I know to talk about a cochlear implant? Or, I've been reading up, my friend got a cochlear implant. So a good list I go over is I say, how are you doing with your hearing aids? While you're wearing your hearing aids, do you have difficulty hearing a noise? Are you still asking people to repeat? Are you misunderstanding people? Do you have issues with the telephone, the TV? Even with the best hearing aids and trying different hearing aids, are you still struggling? Insurance, of course, has criteria of what they will pay for to get a cochlear implant. But a lot of times, you've had to have tried hearing aids, weren't successful, still really struggling with a lot of these questions. As far as then when you come see us for a cochlear implant evaluation, we do a full hearing test just like you would get every year if you're going to go get hearing aids. But then we do a lot of testing with your hearing aid or a hearing aid in that's programmed to see how is this person doing with a hearing aid in quiet, with a hearing aid in noise, and sentences in quiet and sentences in noise. So that way we can try to, simulate a real world situation and then see if you qualify for insurance to cover a cochlear implant. So it's about a 2-hour appointment. About the first hour is just us going through the testing. The second hour is a lot of counseling, and talking about what these results would mean to you. So I really like this slide because it makes a really good point. As auditory function declines, technology requirements increase. Kind of like what Dr. Gifford was saying, there's Roger devices that you could use when you're in noise. You kind of start out, a lot of patients right now, maybe that have mild to moderate loss are starting out with those Apple AirPods and they're saying, oh, this is nice. Well, then if their hearing gets worse, then they can go to hearing aids. And then we can go into, TV streamers, Rogers, FM systems. And then when that's just not useful and beneficial anymore, then we can go to the most technology available, which is a cochlear implant.
And Brenda had her hand up. Are you able to zoom in or click presentation mode on yours?
Oh, yes. Sorry about that.
Much better. Awesome.
Sorry about that.
No worries.
Yeah, I really like this slide because it kind of shows, like I said, as your auditory function decreases, there's way more levels and more technology to help you. So now we'll go through the parts of a cochlear implant. So like I said, compared to a hearing aid, there's actually two parts. There's the part that sits on the outside, which is your sound processor, kind of like a hearing aid as far as you see it on the outside. It comes in different colors. It can be a little bit bigger, a little bit smaller. But the internal device is what your surgeon would go in and implant in your cochlea, which then attaches to a magnet to your external device. And as you can see, you can get fun colors. They can be waterproof. You can put covers on them. There's a lot that they can do now with the CIs. So there's different companies. This is an example of a company called Advanced Bionics and how a cochlear implant is working. They're all about the same, but basically the microphone captures sounds that pass through the ear. The sound waves are converted into information by the processor, and the magnetic headpiece sends the signal to the implant. The implant takes the signal and directs the electrode array to send a signal to the hearing nerve. And then the hearing nerve is sending that sound to the brain where it's interpreted. So a lot more is happening with a cochlear implant than with a regular hearing aid, which thus gives more clarity. So when you're considering a cochlear implant or getting a cochlear implant, it is quite a journey. So you would first start off getting your hearing evaluation, and then your audiologist would work with an ENT who's going to be doing your surgery to make sure you have medical clearance. What that means is they would do an MRI, make sure there's nothing anatomically that you couldn't get a CI with. And then when you come back after you've been cleared, we talk to you about, there's different manufacturers. What, should we do one ear or two? What's our goals? Let's make a treatment plan together. Once that is figured out, then we work with the surgeon or the surgery center to schedule your surgery date. Then you come back about 3 weeks after your surgery and we activate your cochlear implant. If anyone has ever watched those videos on Facebook or YouTube where people can hear out of that ear for the first time, or sometimes they activate babies' cochlear implants, it's a pretty exciting appointment. Some people, can just say, oh, wow, everything sounds good. Some people initially say things sound like Mickey Mouse. I mean, it's a really interesting appointment, but it's one of the best appointments we do. And that's usually about a 2-hour appointment. You are seen the most in your first year just because we see you at least every month just to mark your progress and see how well you're doing post-surgery. So, like I mentioned, unlike hearing aids, there's only three CI companies in the world: Cochlear Americas, Advanced Bionics, and Medel. They all are great products. They all just have, differences, just like the hearing aid manufacturers. And like Dr. Gifford was saying about hearing aids, it's just something that you and your audiologist and your surgeon kind of discuss to say, okay, I think this would be the right product for me. Cochlear Americas was the first ever cochlear implant company. Their product right now, they are on the Nucleus 8, and you can see the top processor is the over the ear Nucleus 8 processor. The bottom, the smaller ones, is the Canso 2 processor. So you get to choose between those to say, okay, I want this one. It's a little bit more discreet, or I like the Nucleus 8 processor because it actually has something that can hold onto my ear and I feel like it might not fall off. There's a couple of pros and cons to each. Like I said, you can see there's different colors. This works with a hearing aid company called Resound. So also another thing, if you're going to get a hearing aid on one side, we talked to you about the different companies so you know which hearing aid company that you would get on the other side, so that way they could link together in an app. This is nice for Bluetooth connectivity, for TVs, microphones, and phones. The second company is called Advanced Bionics. So same thing. They have two different processors. One's a little bit bigger, one is smaller. This one, like Dr. Gifford was talking about, is the company with the Roger. And you would get a Phonak hearing aid on one side. Then you could use your Roger TV connectors, that kind of thing. The third company is called Medel. As you can see, they also have their two processors, the Rondo 3, which is smaller, and the Sonnet 3, which is their new processor they just came out with about a month ago. Same thing right now. They say you can fit with any hearing aid, but they just teamed up with a company called Starkey that's going to do what Resound does with Cochlear and what Phonak does with Advanced Bionics, where they can share accessories for streaming. Like I mentioned, though, the important thing about the companies is just working with your audiologist, your surgeon. They're going to tell you based on what you're looking for, your needs, your goals, what they recommend, and what they've had the most success with. Does anyone have any questions?
Awesome. All right. So now is open question and answer. So we're seeing if there's any questions from the audience. Okay, well, while we wait while we wait for questions, you can also type in the chat box if you have any questions. For me, I do want to share a little bit about my story. I do wear hearing aids, and I did want to add as well, Laura, oh, sorry, Dr. Yons, could you go ahead and put your slides
Yes.
down real quick? That way the
Yes.
interpreter can see me clearer. Awesome. Okay, is there any questions for both audiologists? We do have a little bit of time left. We have about 10 minutes left. All right, let me monitor the chat really quick. So as I was mentioning, I am a hearing aid user. I did have, different companies that I did an evaluation through and testing, sounds on each side. And, I did kind of like, trying out hearing aids, like trying out one for a week, seeing if it worked out for me. So that was a really interesting and complex process for me. There was a school that I went to in Rochester, New York, RIT, Rochester Institute of Technology. When I went there, I was actually able to borrow from their program a hearing aid. So because I got tested there at RIT, I was able to use their hearing aids, and then that's where I found the preference of what I use today. So I do talk myself, and I can hear some, but I wouldn't be able to hear what you guys are saying to me. So that's why evaluations, not just a one time, but continuing the process over a week or 2 weeks, testing out different products can be really helpful. As you mentioned, each person does have different hearing preferences and needs, right?
Absolutely. And especially if someone's not worn hearing aids before, it sounds like this was your first experience with hearing aids when you were trying them out. If someone's doesn't know what they're missing, they don't know what to expect. And so improving your hearing is an investment in time, in money, um, and it's a process. You don't just put them on and hear perfectly the first time. So that's one thing that again, you have to find the right provider who will work with you because I can see a patient and do their test and think I know what they need exactly. I'm like, this is going to be great. They're going to love it. And they hated it. And so that's okay. We start over with a different brand or a different style. And it's, there's something out there for everybody. We can find something to work for everybody, but it's very, very personal and very um, unique.
Absolutely. Yeah.
And
And that's
there's
true. And so, especially, I started wearing hearing aids at a young age, so about 3. But my hearing, it was my experience was different. My brain was used to what I was hearing at that time, and it was different than, a person who might be late deafened and are getting hearing aids later in life, and they might not know,
absolutely.
you know, it takes time for the brain to get used to what sounds there are. And so I did a lot of listening training growing up. And so I would, train to hear what a vacuum sounds like or what a toilet flushing sounds like. So that way that my brain would develop the memory of those sounds. So I am just curious for cochlear implants. Do those sound different? That's just an interesting question. I've never experienced a cochlear implant, so I don't know if something would sound different if I had a cochlear implant versus a hearing aid. My friend told me that cochlear implants can sound robotic sounding. Is that correct, Dr. Yance?
Yeah, so basically, a hearing aid and a cochlear implant are just going to be based on how long the brain has went without sound or what they're used to. So if you had gotten a cochlear implant and you were used to a hearing aid at the beginning, some people say, yeah, robotic Mickey Mouse, it takes a couple weeks to kind of get used to it. But some people, if they put it on and they're like, oh my gosh, and crying and say it sounds so much better, it's really just dependent on the brain. It's crazy how much the brain is involved in this process. Like you were saying, having to retrain your brain, how the vacuum sounds, how those different things sound. Everybody is so different.
Absolutely. Absolutely. All right, and it looks like we have Daniel Moats. He's saying, yes, I do have a question for y'all. Let me go ahead and pin him really quick. All right, he should be showing up soon. Hey, Daniel, go ahead and turn your camera on. All right. All right. Well, yeah, I do have a question. So I myself do have bilateral cochlear implants. The first one that I have, I got it in 1996, and the model is 22. And so I remember way back in the 90s, they didn't let me have, I wasn't able to have it at an early age. I had to wait till I was 5 or 6 to get my first implant. And then, of course, went through the process of shaving half of my head, getting surgery, and then I stayed in the hospital for, I believe it was a week at that time. And really, now, once you get implanted, you can get discharged very quickly, which is so interesting how that has improved. So, growing up being a cochlear implant user, for me, I would hear, like it would sound electric at times, like when people would talk, if it was like really high pitched or if people talked very low pitch, I could hear pitches and I was able to recognize different tones, but it was like there would be times where someone would be like yelling my name or something, and I couldn't tell environmentally where the sound was coming from. But I was able to hear it, but environmentally wasn't sure in which direction it was coming from. So, really, I know some folks themselves have different experiences. Some people can identify where the sound is coming from in the room, but for me, that's still something that I'm not able to identify. So, if a hearing person all of a sudden, like for me, I became deaf at 18 months old. So, so for those folks who become deaf at a late age and their whole life lived as a hearing person, it seems like cochlear implants would be a great option for them because their brain already has all that development and memory of sound that it's used to. But for me, my experience was so much different because I became deaf at such a young age. So can you speak into that and just maybe share a little bit about different experiences that folks have? I love my audiologist. Um, they told me flat out, you will never be a hearing person. Cochlear implants don't automatically make you hearing. And so I still use my cochlear implants because they are useful for me in certain situations, and especially emergency situations, having one-on-one conversations, talking with folks. So I really just use it more on a basic level. So would you be able to talk into that?
Yeah, so that's a great point. So, for example, you getting implanted at 18 months, um, you did it earlier, but yes, if all of a sudden, if tomorrow I woke up and I had a sudden hearing loss and I had no hearing, I got cochlear implants, I would probably do better because my brain was so used to the sounds. And even though it might sound a little different at first, my brain is still used to getting that information. That's why even with hearing aids, you see like, oh, my uncle waited until he was, 80 something and got hearing aids and now they're in the drawer. It's the same situation where when your brain is just not used to hearing those sounds, it can be, like you said, electronic, robotic, that kind of thing. Um, yeah, it's just crazy, like I said earlier, how the brain, and it can be so different for everybody. I have people who, you know, um, after they get their cochlear implant, they within a month say, "Oh my gosh, things are less robotic." I have people who do auditory training, practice listening with sounds, and it can take up to 6 months. So everybody is just so different. But you made a really good point. Just like a hearing aid, a cochlear implant is still electrical hearing. So it's not going back to how, you heard maybe when you were born or I heard when I was born. It's still like technology is amazing, has advanced so much and it helps us to communicate and stay in contact, but there's still
Mm-hmm. Yeah, most definitely. I think you're right in that. Well, thank you so much for just taking time to answer that. So oftentimes, my family or, just people in general seem to think, hey, when I got my cochlear implants or when I put, my ears on, so to say, people kind of just expect me to understand everything, but really there's so much that I still miss. And that's just something that I try to educate and
limitation.
emphasize that cochlear implants do not mean you have perfect hearing. And so there's really, it's just important to understand that all cochlear implants, hearing aids, and all technology have their own limitations. So I appreciate you taking your time, and that's it from me. And this is Brenda. Well, thank you so much for your thoughtful question, Daniel. So, um, Dr. Yance and Dr. Gifford, if there's anything else that you want to add, we can go ahead and do that. Um,
I would like to make one more point about resources. Tennessee Vocational Rehab can help working people get hearing aids if it will assist them in their job. And I know of very few jobs that can't be made better by better communication. So that's also an option.
awesome. Awesome. Great. And Dr. Yance, anything else you wanted to add?
Yeah, I was just thinking when she brought that up, there's honestly not a ton of resources for cochlear implants. Now, a lot of insurance will cover them, but there's not. Now, I have seen Tennessee Vocational Rehab buy new processors once you've been implanted. But a lot of times it is just kind of relying on insurance to pay for the initial surgery and processor. But that's something, if you have your consultation, your audiologist will tell you everything up front.
Awesome. All right. Well, thank you both so much for spending your afternoon with us and taking time out of your day to give a presentation and just educate us a little bit more when it comes to the world of hearing aids and cochlear implants. So, the Library Services for the Deaf and Hard of Hearing really enjoys your support, and we appreciate your involvement in our Lunch and Learn. Okay, so we will go ahead and email y'all their emails and their contact information. So we will go ahead and share that. And if you guys have any other further information, you're able to contact me, Brenda Boas Pond, and I can go ahead and talk to our presenters. All right, thank you guys, everyone, so much. Have a great day.
Thank you
Thank you.
guys.
Thank you for having
Have a
us.
good afternoon.
Take care.
Bye.